Hello, can anyone hear me? If you could just comment if you can hear me, that would be great. Hello, can anyone hear me? If you could just comment if you can hear me, that would be great. Welcome to my first live. If you're here, could you just type in the comments where you're joining from? Welcome. Like I said, if you could just mention where you're listening in from, we'll just give a few minutes for other people to join. Okay, I can see the comments. UK, Nigeria. Well, thank you for joining. I hope you can hear me all right, and I hope technology is working fine. So just give it a few like 1 minute. In 1 minute, we would start. Thank you for all the comments. Thank you for joining in. So basically today I'm going to be talking about autopsy myths debunked. So everything you probably heard about postmortems or autopsies is what most likely you've seen on TV. That's because many people, you don't see people saying, you know what, I'm going to the hospital today. What are you going in there for? I'm going to watch a postmortem. That's not usually how it goes. Most people go there obviously to see doctors for many other reasons. So many people haven't really been been exposed to postmortem. So probably all you've heard about it is what you've seen on TV. And most of the time, what we see on TV is not really reality. The real cases are much more fascinating, I think, and much more respectful. So this is the outline in which we're going to be going using in this our discussion. And as an introduction, basically for those of you who don't know me, my name is Emmy, and I am a pathologist. When you tell people that you're a pathologist, many people do not know what you do, and the few people that do think that you only do postmortems. Well, postmortem is part of my job, but that's not all about my job. The reason why I started the Beyond the Autopsy channel is because many people seem to be fascinated by my work. If I tell them, oh, I'm a pathologist, I do postmortems, oh, everybody's like, what really goes on there? So I thought, why not come and share it with the world and possibly teach people. It's not just about sharing the stories, it's about uncovering how the person died so as to help the living. So this is my first live, and again, thank you all for joining. I've seen many of you have already responded to my comment about telling me where you're from. I see people from Nigeria, Lagos, see people from UK, Manchester. One person here said she's from Manchester. So welcome, welcome. Happy to have you. So what we're going to be discussing today briefly is 6 major myths that many people have gotten because of what they've watched from TV. And then we're going to discuss the truths about what really happens. Basically, it's just looking at some PowerPoint slides I've prepared, and then at the end of the day, we will discuss questions. I'll be willing to take your questions, but as we go through the presentation, if you do have any questions, feel free to drop your questions, feel free to drop your comments. I'll be happy to read them and answer them as we go. I know there's a little bit of a delay from when I talk to when you hear me, so I'm going to pause from time to time. But first of all, before we proceed further, I have opened a community poll. If you could go to the community section, I don't know if you can do that. I just want to know where you're coming from in the sense of which one of these myths have you heard and do you probably believe. So if you can go there, you can choose the poll, or you can do the poll afterwards. But I'll just go to the next slide. So in this slide now, you can see the 6 myths that we're going to be discussing. I want you to please tell me which one you've heard and which one you probably believe in the comment section. So the first myth there, hopefully you can see my screen. The first myth there is autopsies are done only when crime is suspected. What do you think? Do you think that is true, or do you think that is false for myth 1? Myth 2, an autopsy always finds the cause of death. True or false? Myth 3, if the cause of death looks obvious, there is no need for an autopsy. Myth 4, autopsies remove all the organs permanently. Myth 5, autopsies disfigure the body. And myth 6, results come back immediately. So what do you think? I want you to just type in comments which of these myths you've heard more commonly, which one you believe. Just let me see where everybody's coming from so that I know which one to spend more time on. So I'll just give it a few minutes while I read the comments. A few seconds, rather. Okay, I can see someone said 6, that results come back immediately. Okay, we'll discuss if that's always the case. Someone has said 1 and 5, right? Someone has also said autopsy reveals the cause of death. Yes, it does reveal the cause of death, but does it always reveal the cause of death? Is it that every time we do a postmortem, we must find the cause of death? Myth 3. So which one is winning? I feel like every myth has a vote, apart from myth, every myth. I can see myth 1 there. Somebody has said myth 1. Somebody has said myth 2. Autopsy reveals the cause of death. Myth 3. Oh, nobody has chosen myth 4. Okay, so myth 1 to 6, apart from 4. Any other takers as to what you think? Have you heard of any of these ones? Which ones do you believe? Right, so the comments can keep coming while we go straight to myth 1. I think myth 1 is the most common one, from what I've heard. People think that autopsies are done only when crime is suspected. That is not correct. That is not correct. So basically, autopsies, there are 2 forms of autopsies. The medical legal one, which is the one that we mostly do, that's the coroner's autopsy. The coroner is a person that the government has appointed to investigate deaths, basically. So that is one. And the other one is hospital autopsies. So the coroner has been appointed to investigate death. So when the death is sudden, when the death is unexpected, and obviously if a crime is suspected, then we do an autopsy. But sometimes, so if somebody appeared absolutely healthy and just died, what is the cause of death? Nobody knows. So then that is an indication to do an autopsy to find out what killed the person, even if there's no suspicious circumstances surrounding it. Also, if somebody is found and the person has been dead a while, just found dead at home, what killed him? What killed them? So an autopsy will be done. For the medical autopsies, it's usually done to the medical autopsies are the ones requested by the hospital, so by the treating the physicians or the surgeons. Mostly if a surgery is performed immediately and the patient died, that one might actually be a coroner's autopsy or a hospital autopsy. Or if somebody has had like a long-standing disease and the clinicians want to understand how the disease has affected the organs, they may request for an autopsy. Or if there's a particular treatment that the patient had when they were alive, they could ask for an autopsy to see if the treatment had an effect on how the person died. So that is that one. So those are the reasons that autopsies are done. But it's not just providing the cause of death. Yes, autopsy, that is the major thing, to provide the cause of death. But that cause of death, it also benefits people. It answers family questions. I'll give you an example. There was a case where the family went on holiday, and when they came back, they found that their brother had been dead at home. And then they were worried, did he commit suicide? What happened? Is it that he was so depressed? If we hadn't traveled, would he still be alive? So they had all these nagging questions. And obviously, when the autopsy was done and the cause of death was found to be a medical cause, their minds were put at rest. Also, too, there was also a case of a lady dating a man. The family was not particularly pleased with the relationship, and then the lady died. The family thought perhaps the man had killed her, but then it was later found in the autopsy that she had a ruptured ectopic pregnancy. So nobody killed her. It was just she just died of pregnancy complications. So in that way, that is how the autopsies, the cause of death, benefits people. It gives people peace of mind. And sometimes too, it's not just that too. Sometimes it also helps the living, in the sense that sometimes we could find diseases that have that are genetic, and then we could tell the family that we found this. The rest of the family may want to do genetic testing to make sure that they don't have the disease, or if they have, to undergo treatment for that. So that is why autopsies are done. May I just ask here, do you personally know someone or heard of someone who had a post-mortem? If yes, why did they have a post-mortem? If you could just put that in the comment section, that would be great, so that I can just have a feel of my audience. Anyone you know that died and had a post-mortem, and why did they have a post-mortem? I'll give it a few seconds to see if any response would come. And if you don't know anybody that has had a post-mortem, you could just write, I don't know anybody that has had a post-mortem. It appears nobody has had anybody that or known anybody that has had a post-mortem. Maybe I'll be running out of a job very soon if no post-mortems have been done. Okay, so let's move on to a known celebrity in Nigeria died and people feel he was killed. All right, okay. Were you able to have the autopsy results been released to the public? Do you know? I don't know anyone. Please keep the comments coming, and then I'll just go to Me Too. So Me Too. Ah, right. Okay. I just reading a comment and it says that someone died had asthma but had a postmortem. So perhaps when we go to one of the other meets, I think maybe meet 4, meet 5, we're going to answer this question about the asthma case. So Me Too. An autopsy always finds the cause of death. Now this one surprised a lot of people because yes, most of the time we do find the cause of death, but not always, not 100% of the time. In about 2 to 5% of cases, the cause of death is not known. In that case, we just write that it's unascertained. That's the word we use here. So medicine doesn't always have the answer. Sometimes the organs look completely normal. Sometimes histology doesn't reveal anything significant. Sometimes toxicology is negative. So sometimes after examining the body, reviewing the medical history, looking at the microscopic slide, looking at all the toxicology results, we just still can't say exactly why the person died. It can be quite frustrating for everyone involved. But so if the cause of death is unascertained, doesn't necessarily mean that the investigation wasn't thorough. It just means that that was the limit of it. So would that surprise you that an autopsy can be done and then no cause of death is found in the end? Let me know in the comments what you think of this one. The most common case why the cause of death can be found is in cases of decomposition, where the person had died for a long while, and then imagine somebody had been dead for 2 weeks before the person is being found. So with time, most of the evidence have basically disappeared. So we really can't find anything anymore. When the person has died for a while, the toxicology is off. Even the organs, they don't look the same, but both with the physical eye and under the microscope. So if they have died for a long time, sometimes we just can't. That is the number one cause of where the cause of death is unascertained. Sometimes too, like electrical malfunctions of the heart, you can't see it. So that can also be a cause of death where we just can't see anything and it's unascertained even after everything is done. So let me know what you think of this one. Yes, timing is definitely important. Just reading your comment, timing is basically very important. In one of my longer videos I put on YouTube, that's why it's good to check on people. It's not nice for somebody to die and not be seen for quite a while. Timing is important. It helps us find the cause of death. Yes, obviously everything in medicine has a gap to be filled. So perhaps you can come into pathology and help us fill that gap. Right. So let's go to the third myth. If the cause of death is obvious, there's no need for an autopsy. So let me ask a question. I'll start with a question on this one. I want to know your opinion. So in a case of a road traffic accident, like you can see in the photo there, in the case of a road traffic accident where fatalities occur, do you think there'll be a need for a post-mortem? So there's a road traffic accident, two cars have, or a car has hit something, or a bus has hit a pedestrian, whatever, head-on collision or not, but there's an accident and there's a fatality. Do you think that there's a need for a post-mortem? Yes or no? If you think yes, why? Why do you think there might be a need for a post-mortem? If you say no, why do you think there might not be a need? I'll just give it a few seconds to a minute to see what your answers are, what you think. Please feel free to comment freely, please. It helps me engage. Okay, I've seen no's and yes. So what do you think? Especially if you said yes, do you have any reason why you think a postmortem should be done? And if you think no, please just comment, let me know. Sensible comment, no, because the cause of death is obvious. Yes, to know the real cause of death, it might be something else, not the crash. All comments are, I like the different opinion. Actually, I had a case of a road traffic accident, really terrible road traffic accident, one of the worst ones I've seen, and I did an autopsy. So the answer is yes, an autopsy is still needed because it might be something else that caused the crash. What if the person died and then lost control and had the crash? Did you think of that? So somebody might be, obviously death can come at any time. So somebody might be driving and dies and then has a crash. A postmortem can shift the blame from driver to underlying health problems. Yes, exactly. What if the person was drunk and because of them being intoxicated, they had a crash? So you see why it's important to know if there was if it was really the crash that killed the person. If the person had died maybe a few minutes before the crash, if there was an underlying condition such as, it could be a medical condition or intoxication, alcohol or drugs that contributed to that crash. So that is quite important too, especially if the person is going to be prosecuted further. So if the driver didn't die, is the driver liable for the death of the other passengers? I hope that makes sense. So yes, appearances can be deceiving. Sometimes a death might look straightforward, but when we examine the body, we discover something completely different. So I know someone mentioned earlier that he had somebody that had asthma, but they still did a post-mortem. So it could be, so the post-mortem will be done to see, is it the asthma that really killed this person? Was there another disease process going on there? Did he die for something completely different, or was it complication of the asthma? So that is why the post-mortem may have been done in that case. So sometimes the person may appear to have died from a heart attack, but the real cause of death might be something like a ruptured abdominal aortic aneurysm. Someone may appear to have died from a fall, but the fall may have happened because they had a stroke or because they had a heart problem. So really, an autopsy isn't always confirming what we already think. So yes, we do it to confirm what we think, but it's not always about that. Sometimes it's about finding what actually happened. I had a case recently where this person, he had, in fact, he even had an underlying malignancy. The person was old, he had been admitted in hospital for a long time, he had an underlying malignancy, and the person died in hospital. and they brought the case for me to do a postmortem. I remember calling the coroner's office, why am I doing a postmortem on an old person with cancer? And they said, because we don't know what killed the person. We can't, none of the doctors are happy to stick their neck and write the cause of death. So I did that postmortem, not happy, thinking that it's going to be like the cancer that has spread, but it was not that. This person had an underlying lung disease that killed them. So again, looks can be deceptive. I'll go to the next myth. If you have any question or any comment, just drop it in the comment. I am absolutely enjoying reading the comment section. Thank you all for staying so long. So we'll go to the fourth myth. Autopsies remove all the organs permanently. So what do you think? I just want to know what your thoughts are. So what do you think happens to the organs after the post-mortem? Comments, please. What happens to the organs? What do you think happens to the organs? Any comments? Are we still here? I'm just seeing a comment, someone asking, could it have been the underlying lung disease was a result of a cancer? No, the person had a bladder cancer and this lung disease was not related to the cancer. No. Yes, it is, yes. I see someone just answered my question about myth 4. I guess it's returned back to the body, preserved for further studies. So both answers are actually correct, really. So during an autopsy, all the organs are examined systematically. And after all the examination, it is all put back in many cases. However, if the cause of death is not obvious after the initial examination, we can take small tissue samples to examine under the microscope. That is histology. We take small tissues from the organ to examine under the microscope. So take a little bit and do histology. We can also take some fluids. So for example, I was talking about if the patient was intoxicated. So we take like blood, eye fluid, and urine. And then in some cases, we can take the whole organ. We might retain it for further investigation. So for example, a person that has epilepsy and suddenly dies, sometimes we might retain the brain to be examined by a brain pathology expert. Sometimes if it's a young person that died suddenly, the heart, there might be some genetic heart conditions or some heart conditions. We can take the heart and send it to the heart experts to examine. So it is in those cases that we don't put those ones back, but we report anything to the coroner. So if we take tissue, we tell the coroner that we've taken some tissue, and we tell the coroner where we've taken the tissue from. And if we retain any organ, we also tell the coroner, and they tell the patient's relative. But those are the minority of cases. Majorly, all the organs are put back, and also too, obviously, in some cases when we take histology, but those are just little part of the tissue. So yes, that is what happens to the organs. But fun fact, all the organs are put in the abdominal cavity. So even if the brain was taken out, we just put the brain back into the abdominal cavity. It doesn't go back into where the brain used to be. Does that surprise anyone? So I'll just go on to the next myth 5. Autopsies disfigure the body. So this one, understandably, okay, I'm just seeing a question. I'll just answer all the question. So how is it confirmed that all organs are returned in each case? I don't think anybody wants to confirm But we are bound by our you can't just keep people's organs. That is against the law. So we are bound to put all the organs back. Nobody confirms. It's basically the doctor and the morticians that try to put everything back. I don't see patient relatives going to open up the body to search if, uh, if all the organs are put in there. So is it the pathologists that open and close the body back? So, well, it depends on, in most cases, the morticians, that's the people, the mortuary technicians, they are the ones that open the body, and then they open the body, bring out the organs, and then the pathologist examines the organs. So it is the morticians too that close the body back. So are all organs inspected one after the other? Yes, all organs are inspected one after the other. Yes, there are some specific ones that the pathologists concentrate on, because like the heart, that is where most causes of death are from the heart. So obviously concentrate more on the heart, lungs, kidney, and liver. Those are the ones that we normally concentrate on. And most of the time, if we are taking histology, it's from these organs, except there's something obvious in other ones. Yes, I'm surprised they just pack all they pack all the organs and put in the abdominal area. Yes, that's what is done. That is what is done, at least in my practice here. So let's go to myth 5. Autopsies disfigure the body. So this myth causes understandable worry for families. The reality is that every person is treated with dignity and respect. The examination is performed really carefully. Usually, most of the time, one incision is made one straight line across the chest down to the lower abdomen, or a Y incision from the neck, two from each side of the neck, just like you're drawing a Y, and then that straight incision from the chest down. And then when everything is done, everything is put back and closed up. The body is prepared appropriately before it's been released. In fact, in many cases, most of the time, after the post-mortem, families come to see their relatives, and it doesn't disfigure. It's in a very dignified way. Yeah, I know people often imagine something much more dramatic because of what they see on TV, but no, everything is covered and try to be put back so that the family don't get scared. We still try to show respect for the person, even if the person is dead. So we'll go to the last myth for today that I have. Results come back immediately. May I just ask your thoughts? How long, in weeks, days, or months, do you think the results come back in? Can I just see the comments? How quickly do you think autopsy results come back? Do you know, does the investigation stop once significant cause is found? Oh no, it doesn't stop once a significant cause is found. Even if a significant cause is found, we still examine all the organs, because in our postmortem reports, we have to talk about all the organs. Yes, so we examine all the organs. Oh, apart from the brain. So if a significant cause is found most of the time in the other organs that are not the brain, at least in my practice, sometimes the brain is not done. That is because taking out the brain requires obviously opening the skull, and there's a lot of dust that comes from that, and that dust can cause some respiratory problems. So if there is a significant cause of death, we could just stop there and not examine the brain, so as not to increase that risk of inhaling dust to people in the mortuary. Yeah, I think all comments are quite right as to I guess it depends on the country. Absolutely, yes. Countries differ. 2 to 3 weeks, 1 week. It depends on how fast the cause of death is detected. 2 to 4 weeks. Results come in a few hours. Okay. In an ideal world, few hours. Okay, so actually, what happens is this. So if during the post-mortem, if the cause of death is obvious, like so what do you think? What do you think might be like an obvious cause of death that you just see? Let me hear. in the comment section. Let me see in the comment section. Obvious cause of death. Very obvious. What do you think? Choking. Choking. Electrocution. Hmm. Someone else. Okay. So in choking, okay, I'm guessing you can see but you see in choking you really wouldn't see much because choking is just it's quick. Choking is quick. So you wouldn't see much in terms of changes. So if you do see an obstacle blocking the airway, yes, that could be a giveaway. Electrocution. You really can't see electrocution. So in an autopsy, what you can see, you can see the effects, but you will still have to, before you give electrocution as the cause of death, it's not as straightforward. It's not one you just give like that. You have to, because you can't see it really. Someone dying of COVID. No, someone dying of COVID, because you need to do tests. You need to confirm that the person had COVID, so you need to take swabs during the autopsy, and then maybe you need to take histology of the lung. So that one wouldn't be an obvious cause of death. Maybe someone dies during childbirth. So if someone dies during childbirth, you still have to find out why did they die during childbirth, what caused that death. So it's not as straightforward. Cardiac arrest. So if cardiac arrest, what caused the cardiac arrest? That's what you have to. So we can't give cause of death. Can't be cardiac arrest. Hunger strike. Hunger. You can well. Hunger. What you're going to see is just for the hunger to kill. You're just going to see someone that is uh someone that is very cachectic, very thin, and low BMI. Injuries are clearly visible. Death caused by stabbing. Okay. So in cases like a ruptured aneurysm, so that one, when you immediately you open the abdominal cavity, you're just going to see blood everywhere, and then you're just going to find out where the blood is coming out from. So that is quite obvious to see. Or and cases like pulmonary embolism, where there's a clot in the lungs, that one you just, when you open the lung, you see it. So those are the two examples I can think of readily. That is an obvious cause of death. So if I'm performing an autopsy and I see an obvious cause of death, then at the end of all autopsies, irrespective of if I find an obvious cause of death, I have to send a preliminary report to the coroner and write my cause of death. So that in that report, I'm basically telling the coroner, this is what I found. So I'll write my cause of death. So in the case of pulmonary embolism, I'll say cause of death, pulmonary embolism. I haven't taken any tissue. I haven't taken any fluid for toxicology. So the result is out, but I'll still have to write my report. I'll still have to write my full report where I talk about all the organs I examined. I talk about first off in the report, I have to talk about the story, how the person died, the person's medical history. After all, we are still doctors. And then my examination findings, and then why I think the person died from pulmonary embolism. So I have to write my report. So the report, the time I take in writing the report depends on how busy I am. But the cause of death can come out on that day. But if it's a case where I have to do histology, maybe like someone dying of COVID, where I have to take swabs and send to the microbiology lab, and I have to take tissue for histology. Obviously, in my preliminary cause of death, I'm just going to write, I am awaiting COVID test, and I'm awaiting histology. So it is when I have my COVID test back, I have my histology, I've looked through my histology, then I write the cause of death in the report. So in that case, they really don't have a preliminary report or a preliminary cause of death. It's until they get my report. Does that make sense? So if it's an immediate one, I write that my preliminary report and send to them immediately after the cause of death, and they know what killed their relatives. The coroner send it to the patient family. They know what killed their relative. But if it is a case where I can't find the result, the preliminary report will just say awaiting whatever I'm awaiting, and then when I write my report, that's when they are going to get it. So it can take Histology usually comes back in a few days. Toxicology can take 1 week or so. Then I have to put it all together and write my report and then send it to the coroner. So, and then in some cases, I mentioned that sometimes we need to send the brain or the heart to specialist. That one can take a long time because specialist has to receive it, write their own report, send it back to us, and then we now write the final report. So that one can be long. So basically, the time frame varies here, but it's not almost immediately as we see on TV most of the times. So yes, those are the 6 myths that I wanted to discuss with you. Thank you so much for joining me. Now I am just going to stay. If you have any questions, feel free to put your questions in the comment section. But I'll just go to this slide. So the key takeaways. I'm just waiting for you to put your questions so I can answer. So basically, autopsies are about finding answers. They help families, they help the doctors, they help the judicial system. We try to perform them with dignity and respect. I believe that everybody tells a story. One is as to how the person died, and the other as to how the living can live. Every story can save a life, and that's why we do what we do. Thank you for joining me. If there's any particular topic you would like me to put on my next live, let me know in the comment section or let me know under any of the videos. But I'll just be answering questions. So if there's any question I haven't answered, please re-input your question. Or if you have any question, just put in the comment section and I will answer. So I'll give it a few minutes. I hope you have all watched my other videos. Please go to have you experienced a case where politics influenced the post-mortem report? No, actually, because see, for the post-mortem, what my job is at the pathology is to say why the patient died, how the patient died. It's the job of the police. So, for example, if the patient was stabbed to death or it was a gunshot, so my job is to say this patient died from a gunshot. I am not the one to say who shot the gun. Does that make sense? So my report is how this person died. Police finds out the other parts. I hope that answers your question. So the politics can be with the police. Yeah, and most of the time, the cases that we deal with, they come from the coroner. So the coroner gives me the post-mortem to do. I discuss with the coroner directly. I don't even have access to the family, except the family wants to speak with me. So the politicians wouldn't know who is performing the post-mortem until the post-mortem result is out, and then obviously my name will be on the report that I signed it out. I hope that answers your question. If you've not mentioned where you joined in from, if you could just put it in the comment section, that would be great. So basically, all death requires an autopsy. No, not all death requires an autopsy. Not all death requires an autopsy. No, in some deaths, no, not all death requires an autopsy. Some deaths, if the clinician, when I say clinician, that is the doctors who see patients that are alive. If the clinicians know what the cause of death is and they are happy with it, they write it in the cause of death. They don't have to send it to the coroner. And also too, in the UK, there's a medical examiner system. So even if the clinicians are not happy, there's a medical examiner that will go through all the patient's history and he can also write the cause of death. But if both of them can't find the cause of death or can't agree on the cause of death, then they send it to the coroner and then we do a post-mortem. So special thanks to Nkeruwem Ekanim WOCXV. My chat says that you're the #1 commenter, and the #2 is Opeyemi Kiton, and #3 Emmanuel Ogede. So thank you to the chat says that these are the top 3 commenters. So thank you for joining. Thank you all for commenting. I appreciate. I will send out the next live. If you have anything that you want me to talk about in my next live, let me know. If you have any suggestions on how to improve, let me know. Can the family say they don't want autopsy to be done on their dead person? The family can say, but it's automatically the coroner's decision. So the coroner is somebody appointed by the government to investigate death. So the family says, I don't want an autopsy done, and the coroner feels that an autopsy is needed, the person is going to have an autopsy. I hope that makes sense. You can't just opt out. But most of the time, the coroner tries to go with the patient's family's wishes. But in a case where they have to do their job, then they have to do their job. So what can happen sometimes is that they can do a limited autopsy where you don't examine all the organs, and then they give you a specific, maybe they say examine only the heart, so we can do that. And there's also CT autopsies where you don't open the patient can go through a scan instead. So in that way, the coroner tries to accommodate the family's needs, but it doesn't always work. Like I said, can the cause of death be due to old age? Yes, in England, cause of death can be due to old age. I think if the patient, don't quote me on this, I can't remember. I think if the patient is more than 85, it can be old age. I'm not sure on the specific age. You could check on it, but yeah, if the patient is a certain age, old age can be a cause of death. Clinically though, I don't think, but in post-mortem, I haven't seen anybody put old age. You could put old age in like a contributing factor, but not like the main cause of death for after performing an autopsy. Who pays for the autopsy? Um, who pays for the autopsy? In England, is the coroner that pays for the autopsy. Where my practice is. I I think yeah, that's what I know here. Other countries, every country has their own system here. As are parts of the body kept for future reference. So, Ellen, I mentioned earlier that no, we're not allowed to just keep parts of the body for future reference, except the person while alive specifically asks that they can keep for future reference, or that is the family's wishes. If we do histology, like I mentioned, take parts of some part of the tissue or organs for histology to look at them under the microscope. We keep those ones, we keep the slides. But yeah, but nothing else. Except the family says that you can keep it for education purposes. How much does an autopsy cost? I don't know. Maybe I should find out. Maybe I'll ask I'll let you know in my next life. Maybe I'll ask the coroner's officer how much does an autopsy cost. Thank you very much. Any other questions? So obviously YouTube is going to post this section on my channel after some time, so you can always go back to watch it. You can still drop questions in the comment section and I would answer them. Thank you for joining me. I appreciate. Oh, you're very welcome. I should be thanking you all for joining. And I'm glad technology worked. I was quite apprehensive that it wasn't going to work. Thank you. If you have suggestions on how I can improve, please let me know. I would appreciate. You're welcome. Thank you all for joining. I'll just give it 1 more minute, then I'll end the broadcast. Thank you so much. But you can always keep your questions coming. I will answer them. Please subscribe if you haven't done so. Kindly subscribe to the channel. Watch the other videos. Drop your comments. Tell me how you think I can improve. I am open to suggestions. So thank you. Thank you. I'll be ending.